Intuitive Surgical uses a distribution model or distribution partners for their sales throughout Latin America. Using that type of model brings many benefits and a couple of challenges as well with it. The benefits in particular I see as being threefold. First of all, it provides a geographic specification and knowledge that we as a company don't have, but they do locally. Second, that involves a couple of employment norms that, again, we may not have the knowledge of, but they locally do and are able to manage that. And then lastly, they carry multiple product lines. And from a total business perspective or a solution perspective for a hospital, many times that can provide a lot of extra value besides just bringing the DaVinci to the hospital. On the challenge side, there are some business practices that are very different in some of the local markets versus what we're used to here in the United States. Also, having those multiple product lines means many times it's hard to get a little bit of mind share with the distributor partners. And then lastly, it's always a challenge to make sure that our goals are actually aligned with their goals at the same time. DaVinci Surgery is a very highly specialized surgical technique. And as such, it tends to go into centers within Latin America that already offer highly specialized surgical techniques, that currently exist. One of the interesting things about that, though, is that if you truly want to reach all patients, which of course we want to, you have to then also think about the public healthcare segment. So unlike the US, where that's kind of a bit more of a homogeneous mix, within Latin America, those are very, very distinct patient populations. And so the entrance strategy to be able to bring your product into those two different worlds, we'll call it, is indeed different and indeed needs to be looked at differently with whatever product you're bringing. Within Latin America, we definitely look at the sale of a DaVinci program in a slightly different way than maybe in other parts of the world. We really look at it as a full program and as a bundle, if you will. So we bundle together not only the capital part of the DaVinci, but also instrumentation that could be utilized for several years, technical service to make sure that it stays up and running with no issues, and then also the training aspect of the surgeons and the staff that would be involved with it. So why do we do that? We do that because within Latin America, there is a lot of political considerations that are not nearly as prevalent in other parts of the world. And what we don't want is that a DaVinci program is started under one politician, that politician changes, and now all of a sudden the program collapses because they don't have the availability to go back and ask for more funds, and ultimately the patients don't receive that care. Despite the fact that we live in a world today that technology has allowed us to transcend borders in many aspects, within our business and DaVinci Surgery, there are indeed some cultural norms that impact us in Latin America. I see it in two primary areas. The first of which is that the patients within Latin America very much take whatever the doctor's opinion is as a rote truth, and also whatever their opinion would be for a treatment pathway, versus other parts of the world where maybe there's a bit more of a consumer mentality. And so a patient may walk in with a little bit of an idea on not only their condition already, but maybe even what they want to have done as a treatment. Second, I see it within one of the specific surgical segments that we serve, and that's in gynecology. So other parts of the world, a uterine preserving procedure may be something that is thought about but not necessarily really hinged upon, versus in Latin America, that's very, very culturally important to the patients. And so that not only impacts the volume of procedures that happen, but even the techniques that are sought after.